Hi, I'm sure you'd agree with the fact that ADD on its own can present a lot of challenges. But what if it exists with something else? Today we're going to talk about comorbidities. These are co-occurring disorders, each of which meets criteria for a separate diagnosis, and it often requires separate treatment. We find that ADD rarely rides alone because 2/3 of people with ADD have a comorbidity. And I'm going to go through a number of these comorbidities and their occurrence rate. And if you want me to do a deeper dive into ADD and one of these comorbidities, let me know in the comments. I'd be happy to make that video for you. Depression. Depression is that dark blanket that encircles people. And for people with ADD, it occurs at a rate of almost 20%. This means that 20% of people sometime during their lifetime are going to experience a major depressive disorder. On a 12-month basis, at any one time, we'll see about 18.6% of people experiencing depression. This is a really high rate. Then we have depression's little brother, something called dysthymic disorder, and that occurs about 12% of the time. You can think of dysthymic disorder as lower grade depression. People feel flat. They wind up going to work, but they just don't find much joy in their life. And this too is a treatable disorder. Primary medications for these disorders are antidepressants. And antidepressants are not without their liabilities. Every medication has side effects, and that's the dilemma. For most people, they can find an antidepressant that has minimal side effects. Other things that help that depressive response are, if you live in a northern climate, D3. Another thing that's really helpful is fish oil. One of the things that we know about depression is that depression leads to a systemic inflammatory condition. We note that when people are depressed, a number of inflammatory markers increase. And when the FDA came out with a recommendation for fish oil as a prophylaxis for developing depression, they had no idea why. And now we do. We know that fish oil is a really good anti-inflammatory. Bipolarity spectrum disorders. You know, if it's bipolar 2, oftentimes this is really difficult to diagnose. The average person goes to over 7 clinicians before someone gets it right. But going to a clinician that has background in psychiatry, they ought to be able to differentiate that because that's part of psychiatric training. Bipolarity has an interesting genetic commingling. We know, to the best of our science today, that we should look at the X chromosome for bipolarity. We find that bipolarity is about a 20% occurrence rate. And yet for ADD, even though the genetics are completely different, we find a co-occurrence rate of 19.4%. And this has always struck me as interesting because it's right about the same. If you have a population of people with ADD, almost 20% are going to have bipolarity. If you take a population with bipolarity spectrum disorders, about 20% are going to have ADD, even though we know the genetics are completely different. Anxiety in ADD, boy, sometimes that seems to go just hand in hand. One of the things we know about the relationship between anxiety and ADD is that oftentimes performance issues and worries about those are the triggers to anxiety. What I find as a clinician is that when I treat anxiety, people very, very frequently report that their anxiety has leveled off. It may not completely go away. Again, comorbidities are separate diagnoses, each meeting criteria for that diagnosis. Panic disorder. That happens at a rate of almost 9%. And that is among the anxiety disorders. This is where people have excruciating episodes of panic, where they're short of breath. Oftentimes they feel like they're being smothered. They may have tingling in their hands and feet. They may also experience a sense of vertigo. The world is spinning. Sometimes it gets to the point where people are nauseated or even vomit. It's interesting because panic has two classic thought sets, and sometimes people have both of them. People either think they're going to go crazy or they're going to die, and those are pretty awful thoughts to have. But again, 9%, almost 9% of people with ADHD will have a panic disorder. Substance abuse disorders. At some time during the course of a person's lifetime, they will meet criteria for a chemical dependency use disorder. Now, the nomenclature on these has changed, and I think it's really better. It no longer looks at splitting hairs between abuse and dependence. Basically, the bottom line is if it gets in the way of your life, it's a use disorder. And I kind of like that. It's a broader, more inclusive term. The 12-month average for comorbid chemical dependency is about 15.2%, but it's much higher when you look over the lifetime of an individual. This can be as much as 60 or 70%. And for some people, it's interesting because substance abuse just drops out. The interesting correlation is treating kids in their adolescence. We find that treatment of ADD actually has a prophylactic effect for developing a comorbid chemical dependency use disorder. For boys, it drops to dead even with their non-ADD peers. For girls, it drops to even lower than their non-ADD peers. And this is a pretty interesting correlation. Autistic disorders. Those occur at a fairly low rate, but are often comorbid. About 4% of the time we'll see them together. And it is often hard to differentiate ADD from autism. It takes really a specialist in that to really determine whether it is indeed a separate disorder. Now, I follow a particular page on Facebook, and it doesn't allow input by other clinicians. But my heart goes out to these people because you see all sorts of posts about just the difficulties people have with their kids' often outrageous behavior. And I'm going to include a link to a video I did on teaching kids self-regulation. That'll be at the end of the video. But oppositional defiant disorder. These are kids that are just plain contrary to a lot of different things. They may act out a great deal. This is really hard for parents to deal with, and oftentimes requires a lot of social support, not just for the child, but for the family, because this tries the souls of people's families big time. And it's unfortunate this particular Facebook site is absolute about not allowing other input. It's an unfortunate thing that they limit information in that way, but it is what it is. So this has been G.H. Glade for Coaching ADD. As I said before, if you want to see me take a deeper dive into some of these comorbidities, I am happy to make a video about that. I've been a practicing clinician for over 40 years, and I've always worked in really acute environments. And I have a lot of experience with all of these comorbidities and their treatment. So if this has been a helpful video for you, go ahead and subscribe. And if you like this video and if it was relevant to your needs, give it a thumbs up. I appreciate that. And that helps spread the word of this particular YouTube platform. And if you know people who are struggling with a comorbidity, let them know that they're not alone. Refer them to this video. There is help out there. Imagine the dilemma if you did what I did for a living and people never got better. That would be a pretty awful job. So thank you for spending the time with me. I will post another video on Monday where you're welcome to return. Take care. Have a great day.